Welcome to a demonstration of the Semmes-Weinstein Monofilament Screening Assessment. Throughout this video, I will be referring to the common sites used for the 5-piece monofilament assessment, and then I will be demonstrating how to use this hand grid to develop an intervention plan for my grandpa. Hi everyone, Josie here. I'm with my grandpa Bar. He goes by Tony. He's 81 years old and is a retired teacher of 30 plus years. 34 plus years. So Grandpa here has an extensive medical history. He was diagnosed with type 2 diabetes and had open heart surgery. He also just recently got diagnosed with a tumor near his brainstem, and so that's what puts him on hospice today. He has not been diagnosed with neuropathy, but with the monofilament assessment, we're going to hopefully screen and see if any of his conditions could be contributing to superficial sensation pathology. So, Grandpa, if you're all right, I'm going to ask you a couple questions.
I'm ready to faint.
So, for hand dominance, are you left-handed or right-handed?
Right-handed.
You're right-handed. Okay. And then, have you ever felt like you were wearing gloves? Like, have you ever felt like your hands had kind of a fuzzy feel to them at all?
No.
No? Have you ever been woken up in the middle of the night with pain sensations in your feet or your hands?
No.
Okay. And then have you ever experienced difficulty distinguishing temperature?
No, not really.
Okay. Well, that's good.
Yeah?
Yeah. So if we take a look at your hands here, this is partly due to your blood thinner, which is aspirin at this point, but he used to be on Coumadin. So you see a little bit of the blood pooling in his skin.
Oh, is that what causes it?
Yeah. It's a little translucent too. So your skin's very fragile, which is why you shouldn't be picking.
Yeah, that's right. I thought that was what you call it?
A little scab.
Scabber.
Yeah.
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 Well, anyway.
So for this assessment, what I'm going to have you do is actually flip your hand over so it's palm up. We're going to make sure that the environment's quiet, so as long as Grandma's done doing her chores, I think we're going to be okay. And I'll just have you rest your hand on the bed here so you're nice and comfortable, okay? So what I'm going to have you do is I'll make sure that your eyes are closed during this assessment, and whenever you feel me touch your hand with my little tool here, you're just going to say touch, okay?
Okay.
So I'm going to start off with the lightest touch pressure here. So I'll have you close your eyes. And there could be a long pause, so don't worry if you don't feel anything right away, okay?
Okay.
All right. Okay. So that was the light pressure one. Did you feel anything?
Nope.
Nope. So I'm going to go to my next one, okay? Keep your eyes closed. You're doing a great job. Okay. Did you feel anything that time?
I thought I felt a little, very slight touch.
Okay. But you didn't say anything. So
No, I didn't know what to do.
that's okay. So I'm going to do this one again. And whenever you feel that really light touch, say touch. Okay?
Mm-hmm.
Let's go up one more. All right. So eyes closed and say touch when you feel something, okay? Good. You're a straight A student. We're done with the assessment.
Oh, okay.
You can open up your eyes.
All right.
Thank you for letting me practice this with you.
Yeah.
And for teaching my friends who are going to learn from this.
Yeah, I know. Zach is going to learn a lot.
All right. So we're all set with the monofilament assessment.
I printed off the hand grid that I demonstrated to you earlier to help demonstrate the information gathered in the monofilament assessment. As you can see, the areas shaded in purple demonstrate diminished protective sensation. Using our knowledge of the innervation in the hands, we can see that the ulnar nerve may be affected by Grandpa's condition. Due to diminished protective sensation, interventions designed for Grandpa would mainly focus on compensation so that we could prevent further injury to his skin. One way to do this would be to improve his awareness, which would then by improve his safety. It is important that Grandpa is understanding that he can use his eyes and his ears to help protect his skin. This can be done by encouraging him to look at his upper extremities and lower extremities regularly to see if there are any signs of redness, edema, warmth, or if there could be excessive force or repetition of pressures being sustained on his joints. You could also encourage Grandpa to use adaptive devices. This could include built-up handles to help with mobility in his bed, or it could even include cushions or straps or protective mitts to help with distributing pressure in the bed and even protecting his hands from picking at his skin. It is important that we prevent skin breakdown by using oils that can lock in moisture and to use frequent position changes that can help relieve pressure over his affected areas.